Hello friends, welcome to my next video, The Art of History Taking. With the COVID pandemic becoming dominant over our society today, clinical examination using a hammer, a stethoscope, a torch and a tuning fork has taken a step back and history taking has come back to its glory as it was before. So here are a few tips that can help you ease the process of history taking. To start with, the first tip. Patient usually comes with multiple complaints. Let's say the patient comes with complaints such as 2 दिन से मुझे चक्कर आ रहा है, सिर दुख रहा है और उल्टी जैसे लग रहा है पर उल्टी हो नहीं रही है. Then afterwards patient stops for a while. Then we ask और कुछ कोई तकलीफ? नहीं और कुछ भी नहीं है और कुछ भी नहीं. हाँ बस 5-6 दिन से संडास में खून जा रहा है. So you see, patient gave a history of lot of complaints but finally came to the main complaint which was highly essential. So a number of complaints come to the picture, but the most important complaint which is bothersome to the patient comes in the end. So it's important for you to realize which complaint is necessary and which complaint can guide you towards diagnosis. So listen to all of them and then decide which complaint is the most bothersome of all. Moving on, some extremely educated patients come to you to say, सर मुझे ना बहुत दम लग रहा है और ना मुझे बचपन से ही दमने की बीमारी है. Listening to this, you will start writing known case of bronchial asthma and then you will say came with acute exacerbation of breathlessness. Wrong. This is what is completely wrong. Never ever accept blindly what patient's diagnosis is your diagnosis, which is completely wrong. Ask him, दम्मा कैसे पता है आपको? So then he'll say, वो क्या है ना बचपन से ही मैं पंप ले रहा हूँ. And then afterwards you will ask कि सिगरेट बीड़ी फूकते थे क्या? And then he will say, नहीं ऐसा कुछ नहीं है, बस बचपन से ही ये प्रॉब्लम है. And then comes your differential diagnosis like cystic fibrosis, neuromuscular weakness or COPD or anything of that sort. So never ever accept blindly what patients tell you as your final diagnosis. Each chief complaint should be mentioned in chronological order with the earliest complaint to be mentioned first, because the earliest complaint would most likely guide you towards that particular system or that particular diagnosis. Fourthly, each chief complaint should be mentioned in the following details. Number 1, onset. Number 2, duration. Number 3, progress. Number 4, location if applicable. Let's say for example complaint of chest pain as to where the chest pain is occurring. 5th, aggravating factor and relieving factor. Relieved with medication, without medication. Any associated features or complaints. Diurnal variation for selected complaints such as fever or cough or breathlessness. For example, let's say a patient comes to you with complaint of chest pain since 2 days. So the correct way of taking the history of chest pain would be complaint of chest pain since 2 days, which is sudden in onset, occurring in the left side of the chest, which is substernal in location, non-radiating, sharp stabbing type of pain, non-progressive and present throughout the day. The chest pain is aggravated on lying on the left side and on deep inspiration, while it is relieved on sitting up and leaning forward. The chest pain is also relieved with medication such as NSAIDs. So this kind of history of chest pain is highly suggestive of acute pericarditis. So you can see from here that if your history is taken of one particular complaint in a very systematic way, it can point towards the correct diagnosis. Coming to the most important point, that is negative history, which majority of us have a big question as to how to approach the negative history. First of all, whenever you get the chief complaints and you take the history of a patient, do not blindly write no history of fever, cold, cough, breathlessness, no history of abdominal pain, nausea, vomiting. Never ever do that. Whenever you get a chief complaint, it is always necessary to go system wise. Let's say for example patient comes with cough or breathlessness. So that means it may localize to a system like respiratory, cardiovascular. Sometimes it may localize towards abdominal. So begin with the first system, let's say respiratory. So the most common respiratory complaints that need to be asked include cough, which may be dry or productive, breathlessness, history of hemoptysis, or let's say noisy breathing. Then followed by the history which pertains towards cardiovascular system. Like for example, chest pain, again breathlessness, but do not repeat it again. Chest pain, then palpitation, syncope, increased sweating, even lower limb swelling and decreased urine output in case the patient is in cardiac failure. Followed by pertaining to abdominal system or the gastrointestinal system, which includes abdominal pain, nausea, vomiting, loose stool, any kind of bleeding tendencies such as hematemesis or melena, burning micturition, and so on and so forth. Followed by, if it pertains to your central nervous system, history such as headache, vomiting, neck stiffness or convulsion, altered sensorium or irritability, weakness of any particular limb, deviation of angle of mouth to one particular side, unable to speak or slurred speech are some of the complaints which need to be asked pertaining to the central nervous system. Next, followed by constitutional symptoms such as loss of weight, loss of appetite, change in bowel bladder habits. All of these should be mentioned in a particular order. And it is not necessary to include all of these complaints in every case history of yours. Make sure that you should be able to correlate the negative history which you are taking with the chief complaint. If you have a proper correlation with it, then only mention in your negative history. For example, if a patient comes with complaint of chest pain and if you're writing complaint of burning micturition in your negative history, then you may not be able to prove it in case you are asked as to why have you asked the question of burning micturition. So always ask history or include it in your negative history if it can be correlated with your chief complaint. Once all this history taking is done, then you should be able to include complaints of etiologies which may be probable towards causing the pertaining chief complaints. So let's say, for example, if a patient comes with abdominal pain or let's say yellowish discoloration of eyes, then the most common etiology which comes to our mind is alcohol. So history of alcohol intake or drug intake may be included in your negative history as a part of your history of present illness. However, many colleges and universities do not recommend so. Some professors would like to include it in personal history and so on. But whatever is the practice of your particular college, practice it in the same way. At the end of the negative history, you should be able to enlist at least 4 differential diagnoses. And in case you're able to enlist 4 differential diagnoses, that means your history is sufficiently taken. This would be the end of your history of present illness. Moving on to the next part, that is the past history. We have a tendency to write no history of tuberculosis, bronchial asthma, hypertension, ischemic heart disease, diabetes, and no history of any blood transfusion. That's it. These are the major components of the past history which we usually write. However, a past history should be taken in a particular detail. The first line remains the same, where it includes no history of tuberculosis, diabetes, bronchial asthma, hypertension, ischemic heart disease. These diseases are clubbed together for one particular reason, that is, these diseases have variety of systemic manifestations, and so including them in your past history can help you diagnose towards a particular condition. After that, it is also necessary to mention no history of jaundice, no history of previous surgery, trauma, or any procedures done, no history of sexual contact. That is another important history which needs to be asked, but it is usually difficult because of obvious reasons. And apart from that, there is one more difficulty, that in case you mention no history of sexual contact, there are high chances that your professor in the viva may ask you what are the sexually transmitted diseases. So ask this history, but do not mention it unless you have read about sexually transmitted diseases. Moving on, that you should also mention no history of blood transfusion, no history of previous hospital admissions or any illness in the past, and finally no history of any drug intake. This whole thing comprises of your past history. Then moving ahead to your personal history, it is important to mention the occupation of the patient. In some cases you may mention it in the beginning of the history, where you include the demographic details such as name, age, address, occupation. However, you can mention it in your personal history as well, but the important thing of mentioning in the occupation is whether the patient is still working or the patient is currently not working. Apart from that, it's necessary to include whether patient is has a vegetarian diet or a non-vegetarian diet. Addictions are another important point, where each of the addictions should be taken into consideration separately. Like for example, you're taking cigarette smoking. So it is necessary to ask whether patient is actually smoking cigarette, BD, hookah, cigar or any kind of smoking item. Apart from mentioning that, every day the quantity how much he takes, for example he takes let's say 20 cigarettes per day, and for how many years he has been taking. Post mentioning that, it is necessary to calculate what we call as the smoking index or what we call as the pack years. So the smoking index is calculated as number of cigarettes per day into the total duration in years. So let's say for example a person has been smoking 20 cigarettes since last 20 years. So the smoking index would be 20 cigarettes per day into 20, that comes to be 400. This we mention because smoking index can be used to grade the smokers as mild, moderate and severe as shown aside. Apart from the smoking index, it is also necessary to calculate pack years. Pack years is calculated as number of packs smoked per day into number of years. One pack of cigarettes consists of nearly 20 cigarettes. So if suppose let's say patient is smoking 20 cigarettes since last 10 years, so number of pack years would be 1 pack year into 10. So number of pack years would be 10. So that is how you're calculating the number of pack years. Apart from smoking history, it is also necessary to mention alcohol history, which may include the quantity per day he's taking, that is, and then the duration of intake, the type of liquor, whether it is a country liquor or whether it is a foreign liquor. Please do not mention brands such as Red Label or Chivas Regal. It is necessary to mention whether it is a country liquor or whether it is a foreign liquor, because there are many alcohol related diseases such as alcoholic liver disease, pancreatitis, gastritis, Wernicke's encephalopathy, Korsakoff psychosis and so on and so forth. So this comprises of your personal history. Moving ahead, in family history, it's necessary to mention whether any family history of illnesses is taking place, maybe stroke or maybe hematological disorders such as sickle cell or thalassemia. And finally, coming to the most important part, that is the menstrual history in case of females. Any menstrual history should be mentioned as numerator, that is the number of days of menstruation, upon the denominator, that is the total cycle duration, followed by the number of pads used per day, which can help you classify it into whether patient is having a scanty flow, average flow or a high flow, with clots or without clots, whether there is associated dysmenorrhea, last normal menstrual period and the menarche and menopause if indicated. Apart from this, obstetric history is also highly indicated if applicable. This entire history completes your aim of disease diagnosis, and it can lead you to a particular differential diagnosis which can be finally concluded with your clinical examination. Hopefully this video has helped you create a direction towards the history taking format. If you like the video, kindly click the like button and the subscribe button. Thank you.